Okay, if you are someone you care about lives with diabetes, you're going to want to listen up, because the entire philosophy of how we manage this condition has undergone a massive shift. We're talking about the new 2026 guidelines, and trust me, this isn't just a small update. It's about moving from reacting to numbers to proactively protecting your health for the long haul.
For decades, diabetes management has basically been a game of numbers, right? All about chasing that blood sugar level. But what if that was the wrong game all along? What if the main goal wasn't just about getting that number down, but something, way more important? That's the huge question these new guidelines are finally answering.
And here it is, the big shift in a nutshell. We are officially moving away from the old goal, which was all about lowering your HbA1c, that 3-month blood sugar average. The new goal? It's so much bigger, actively protecting your vital organs. It's a total pivot from just managing a number on a lab report to literally safeguarding your future.
So, to really get why this change is so revolutionary, let's take a quick look back at the old model. For years and years, the entire system was really built around one single number.
And that number was the HbA1c. It's a simple blood test that gives you a snapshot of your average glucose over the past few months. A lower number was good, a higher number was bad. Simple, right? But we now know it was also incredibly short-sighted. Sure, it gave you an average, but it completely missed the day-to-day roller coaster of dangerous highs and even more dangerous lows. And most importantly, it told us absolutely nothing about the silent damage that could be happening to our organs.
So, let's get into the new strategy. The 2026 guidelines are all about zooming out from that one number and focusing on the parts of the body that diabetes affects the most. We're talking about a completely different, complications-first model that is proactive, not reactive.
The first huge pillar of this new way of thinking is your heart. We know cardiovascular disease is a massive risk for people with diabetes. So the new guidelines now prioritize medications and strategies that are proven to protect the heart. And get this, regardless of what a person's A1C is. Just think about that for a second. We're treating the risk itself, not just the sugar. It's a whole new ballgame.
Next up, your kidneys. Diabetes is a leading cause of kidney disease. But the tricky part is that the damage can be totally silent for years. The new approach is to get ahead of it, using specific medications known to protect the kidneys long before any serious problems even show up.
And this is a big one. For the very first time, the liver is being put front and center in the diabetes care plan. We now know that a serious fatty liver condition, called MASLD, pretty much shares the same root cause as type 2 diabetes. So the guidelines are now calling for mandatory screening and pushing for treatments that actually reduce liver fat. This is a huge game-changing addition.
So, how do we actually pull this off? How do we achieve this new goal of protecting our organs? Well, the good news is our toolkit has gotten a serious upgrade. We're talking about revolutionary new tech and a completely different way of thinking about medications. Let's start with the tech. The old standard, as you know, was manual finger pricks. You'd get what, maybe a few data points a day? Well, the new standard of care is continuous glucose monitoring, or CGM. This little device gives you a constant 24/7 stream of data. And it's not a luxury item anymore. The new guidelines recommend it for all insulin users, right from the moment they're diagnosed. And all that data from the CGM powers the next massive leap, automated insulin delivery, or AID. So forget the old manual injections or even the basic pumps. These AID systems, people call them smart pumps, they pretty much act like an artificial pancreas. They use smart algorithms to predict and even prevent highs and lows before they happen. This tech tackles the single biggest barrier to good control, the fear of going low, of hypoglycemia. That fear holds so many people back from using the insulin they need.
Now let's talk about the medications. The whole conversation has changed. It's no longer just about which drug lowers A1C the most. Now it's about your personal risk profile. So if obesity or that fatty liver disease is the main concern, a dual-action drug called a GIP/GLP-1 is now the top choice. If it's heart failure or kidney disease, a class of drugs called SGLT2 inhibitors is the way to go. And for existing heart disease, it's another class called GLP-1s. See what's happening? We're matching the medicine to the specific organ that needs protecting.
Okay, so we've got a new philosophy, and we've got some amazing new tools. What does this actually look like when you walk into the doctor's office? Let's break down the new targets that really define what success looks like in 2026.
First thing, blood pressure. The old target was less than 130/80, while the new guidelines are getting much more aggressive for people at high risk, pushing for a top number below 120. as long as it's safe to do so. And that's because the data is just so strong that this can dramatically cut the risk of heart attack and stroke.
Next up, weight loss. And this is a huge mindset shift. We've gone from a kind of modest goal of maybe 5 to 7% weight loss to a much more ambitious target, 10 to 15% of your body weight. Why such a big jump? Because at this level, we're not just improving numbers anymore. We are talking about the real possibility of disease remission. Weight loss is now a primary therapy, not an afterthought.
And here's a brand new metric that, honestly, is becoming just as important as the A1C. It's called time in range, or TIR. This is the percentage of your day that your glucose levels stay within that healthy target range of 70 to 180. The goal is to be in that zone over 70% of the time. It gives you a much better, much more real-world picture of your control than a simple 3-month average ever could.
So what do you do with all this? This checklist right here is your new game plan. The next time you see your doctor, you should be getting an A1C and a prescription for a CGM. You should be getting your kidney health checked with a urine test and your liver health with a blood test. You should be setting an aggressive weight loss goal of over 10%. And if you're on multiple daily injections of insulin, you should absolutely be talking about automated insulin delivery. This empowers you to have a totally different, more proactive conversation with your care team.